Good morning. Welcome to a rather dark and gloomy day. There's still snow on the ground and it's tipping down with rain as well. Thank God it's getting a little warmer. It's probably a very fitting day for today's talk, Corona Walks number 17. My name is Professor Edward Borodzicz and I want to talk to you today about death and the death industry and Corona. If there's one video out of this series you should watch, it's probably this one. I've been doing some maths. Yesterday was a commemoration of the anniversary of the freeing of the prisoners from Auschwitz, as the Germans called it. Thank God that horror ended. Today I want to talk to you about the horror that's going on today. The death. Endless deaths in many countries in the world. People dying alone, not being able to see their families. The trauma for the families is absolutely awful. But what worries me the most is the secret amounts of money that are being made out of Corona COVID-19. 100,000 was the estimated death toll by the UK government for people dying within 28 days of contracting the virus. This doesn't include people who died after a longer period, and it doesn't include people who died of other things, other things that they may well have been treated for, but because the beds weren't available, because they were taken up by people suffering from Corona. Not just the current outbreak, but even some still using up hospital beds from the first outbreak with the long Corona. Imagine each one of those is in receipt of a state pension, and imagine that pension's between £8,000 and £9,000 a year. Well, that's almost £1 billion per year, every year that they would have lived, that the government saves. Imagine those people are entitled to NHS care. We know that we use the NHS most when we're very young, when we're just born, and in our first few years when we tend to have lots of inoculations and the doctors poke us around and look at us quite a lot. And then most of us live a fairly happy and healthy life until we get into our sort of late 50s, and then we start using the NHS again. And the older we get, the more we use it, on average. In fact, 2/5 of the entire NHS budget, which is something like £14 billion, is spent on people just over 70. That's not including the people in their 50s and the 60s. Then we need to look at the amount of money that these people would have had spent on them in terms of other types of social help. They might have been in receipt of state benefits, help with their rent, help with their rates, council tax, help with their bills. The amount of money they might have had spent on them to fund things like social care, helping them to live in their own homes as they become more vulnerable, grants to enable them to adapt their homes so they can still live there. And for those that aren't able to live there, the cost of nursing care. Once we start adding up all these costs, the numbers become really quite scary. From an accountant's point of view, the best thing we can do if we get Corona is to very quickly keel over and die. this enables the state to save an absolute fortune. Now, I remember some news reports back in February, March last year, which were very quickly withdrawn. They were coming out of the Conservative Party's advisors, people like Dominic Cummings. You remember the man who needed to drive to the northeast in order to check his eyesight? The famous eugenicist who believes in survival of the fittest. Well, he was actually talking about how much money they would save then. Naturally, the tweets and the remarks and the comments have all been very clinically removed from the internet, so that they're now nearly impossible to find. But that's what he was saying. Is it conceivable that our government, far from being incompetent and stupid, and thus creating the worst death toll in the world per capita of any other country, may actually be engineering the biggest money-saving operation they've ever embarked on? If you're not disturbed by this, you should be. I would like to believe our government are just simply incompetent. As uncomfortable as that makes me feel, that we have an administration that is woefully unprepared and unable, just lacking the physical and the cognitive capacity to manage the health crisis that we're seeing now in the UK. I would love to believe that. But when you look at the numbers, it's quite scary. In fact, the amount of money they're probably going to save from all of this devastating pain that's being inflicted on the population may well more than cover the costs of another little project that they hold so dear. A project that divides us one from another. A project that builds walls where there were none. A project that requires borders where there were none. Project that is also ruining our lives. Let's hope it's just pure incompetence and there was no malice and there was no forethought behind this. And it's just a convenient godsend that suddenly the government finds they've got all this money. And remember, the figures I'm quoting are just for 1 year. If people die who might have lived for another 10 or 15 years, you can multiply that by 10 or 15. We're talking about an astronomical amount of money that the government are going to save because people paid into their pensions. And many of those also had very expensive government pensions or government-backed pensions, like teachers, policemen, military. And if these people die, they don't have to pay a penny. Yet they collected all this money from them during their entire lifetime. I have friends who have lost loved ones. I hear the pain every day. I would hate to imagine that this has been done on purpose. But if you look back over the last year, why was it that the UK government was always the last to go into lockdown, the first to come out of lockdown? Why is Boris Johnson talking about ending lockdown in February? There's 1,400, 1,500 people dying per day. And look at the state of things in the US, where his mate has finally been kicked out of the White House with similar policies. And it's always the same places and the same people. But the UK stands out like a sore thumb. There needs to be an investigation into how so many people died, and was there any culpability to do this for financial reasons. Remember, Adolf Hitler could not have committed the Holocaust without the help of accountants. He needed someone to count the cost of all of the things that he was doing. I suspect there's some people in the woodwork out there that have been paid well to keep quiet. Thank you very much. I look forward to seeing you again in Corona Walks 18.